Every move and every step we take influences scoliosis. In many patients with idiopathic scoliosis, the most common apex of the thoracic curve occurs around the mid-thoracic spine, frequently around the vertebra T7. Interestingly, this region also corresponds closely to the rotational apex of the human gait. During normal walking, the thorax and the pelvis rotate to maintain balance. They conserve energy, they allow efficient arm swinging, and biomechanical studies of gait have shown that the peak rotational motion of the trunk tends to occur around the mid-thoracic spine right at T7, acting as a functional pivot between the upper thorax and the lower trunk. And because T7 serves as a natural rotational fulcrum during walking, it is exposed to repetitive torsional forces throughout our daily movements. Over thousands of steps per day, this repeated rotational loading may contribute to asymmetric mechanical stresses across the vertebra, the ribs, and the surrounding soft tissues. In individuals who are genetically or structurally predisposed, these cumulative rotational forces may help explain why thoracic scoliosis curves frequently develop and progress with an apex in that same mid-thoracic region. Understanding the relationship between rotational mechanics of walking and the common thoracic scoliosis apex helps highlight the role of dynamic biomechanics in spinal deformity. The mid-thoracic spine is not simply a static structure, but a key transition zone that absorbs and redistributes rotational forces during the gait. Recognizing T7 as both a biomechanical pivot in walking and a common scoliosis apex can inform clinical evaluation, imaging interpretation, treatment strategies aimed at addressing rotational imbalance and restoring a more symmetrical spinal motion. Knowing this and similar biomechanics, and specifically how your spine is affected by your scoliosis, is one of the key concepts of ScoliBalance, our scoliosis-specific exercise approach right here at ScoliCare Louisville.